Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the Transportation Department orders the suspension of its reduced physical distancing policy and public transport as President Rodrigo Duterte is set to decide on the matter. And medical experts weighing in on potential repercussions on easing physical distance in public transport. Can the country afford to lessen the distance between commuters? Former COVID-19 Task Force Advisor Dr. Tony Leachon and Clean Air Philippines Movement President Dr. Leo Olarte join us live. It's back to 1 meter between commuters on public transport after officials suspended the controversial reduced physical distancing rule. Transportation Secretary Artugade says he decided to suspend the easing of physical distance between commuters while awaiting the president's decision on the matter. Tugade also said, quote, does not favor that the public views a divided interagency task force over the social distancing policy, unquote. Let's go straight to the source of the story. We have former COVID-19 Task Force Advisor Dr. Tony Leachon. Dr. Leachon, welcome to the source and thank you for your time.
Good morning, Pinky. Morning, Pinky.
The reduced physical distancing, as I mentioned, Dr. Tony Leachon, has been suspended for now as we wait President Rodrigo Duterte's decision on this. Can you tell us how or who should the public believe when it comes to this 1 meter or this 0.75 meter rule?
Well, I think we should base it on science, universality of application, and doability. So if science, then we believe the global agency, the World Health Organization, recommends 1 meter, that's 3 feet, and Center for Disease Control, that's about 2 meters or 6 feet. The European Union sets it at 1.5. And the latest meta-analysis or conglomeration of the data, the Lancet, issued on June 1, 2020, would say that physical distancing would be the single most effective intervention in terms of curbing COVID infection. In fact, with 1 meter, you have 82% reduction. 2 meters, you have 91% reduction. 3 meters, you have 96% reduction. With face mask, the ordinary surgical mask, is about 67% when taken as an isolated intervention, and the face shield is 78%. Thus, of all the intervention, the physical distancing is the most effective and a cornerstone in curbing viral transmission. So that's the first one. The second is universality of application. The DOH would recommend physical distancing at least 1 meter. The DALG would recommend that and even would actually isolate positive individuals from the barangay or communities. The DTI and the DOLE would set physical barriers as well as engineering controls just to isolate individuals and set up work from home procedures just to prevent people from being close to each other. And the problem also as well, Pinky, is the doability in terms of the procedure, in terms of measurement, 0.75, zero point 0.5, and zero point 0.3. And in reviewing literature, I have not across this certain tapering procedure, and it is set at 0.75, zero point 0.5, and zero point 0.3 without thinking of the projections. I think in other countries in which they use that, which is their reference, I think the railway system. I think we should not forget that the Philippines is still in the as the number one country in Southeast
Yeah.
Asia with the most number of cases, 3,674. For some countries, they have flattened the curve, like Thailand. The case is about 3.25. Malaysia, 25.6. Singapore, 200, Singapore 61. South Korea, 234. And Japan, 763. So if the context is basically to have a reference model from other countries, let us not forget that the Philippines right now has an average of 3,674 per day. And if we relax right
Okay.
now, our physical distancing in public transport, this may escalate and, you know, this could actually derail the flattening of the curve, which the UP Octa Research Group has shown that the reproductive number right now in the Philippines is less than 1. It's actually zero point 0.9 at this point in time. So that's
Okay.
where we are
So,
coming from is basically on the evidence, on the science, based on the available literature.
but when you talk about evidence and also science, there's also that statement made by former DOH Secretary Dairit, also supported by former DOH Secretary Esperanza Cabral. But let me first go to what Secretary Dairit said. He said that while true, the WHO recommends a 1 meter distance rule, he says it is not dogma. It should not be gospel truth. He goes on to say that in a way, countries are actually allowed to adjust. So having to reduce the physical distancing, Dr. Leachon, from 1 meter to 0.75. But you follow the 7 commandments: mask, shield, not talking or eating, proper ventilation, proper disinfection, no symptomatic passengers, and appropriate physical distancing. Won't the 0.75 actually work, Dr. Leachon, with the 7 commandments set in place?
Well, those are important 7 commandments, but all of the commandments, the physical distancing is the most important. Based on the Lancet study, the single most effective is actually physical distancing. So just like in the Bible, you have many commandments, but the greatest of that is actually loving God and loving one another. So if you base that on the 7 commandments, based on science, particularly the Lancet study, 172 observational studies, 16 countries. I think this is very powerful. And even you actually combine the 7 commandments, this would not actually be in comparison with physical distancing. If you remember, Pinky, during the time of the ECQ in March, the only significant measure that
Mm-mm.
we actually did was actually not go to office or not go to workplace. It's basically no movement at all. And the protective gear by the WHO was even the WHO at that time was still questioning the face mask. It was only late after 1 month that everybody should wear face mask.
Opo.
If you remember
Right.
1918 pandemic, the 1918 Spanish pandemic, when they relax the physical and social conditioning, you have a surge. And people who tend to ignore history would tend to repeat it. And for those countries mentioned,
Okay.
since they're not dogmatic, you have to take into context that these countries have flattened the curve. The Philippines, aside from Indonesia, has not flattened the curve. Compared with the other countries, we're still hovering from 3,000 to 4,000 at this point in time. So, and going to
Okay.
the holiday season, the more people that will flock to the public transport, that will be a problem. Considering asymptomatic cases, just like one positive, asymptomatic positive case, and then less than a meter, and then exposed for 15 minutes, then you are actually a close contact. And then when you go to the workplace, that will be
Right.
a
Okay.
logistical nightmare, considering those persons actually riding in the public transport will come from different areas, and you will have here pocket surges that would actually be difficult to contain in terms of contact tracing,
Okay.
isolation, and
Dr.
quarantine.
Dr. Leachon, we just need to take a very short break. The source will be right back. You're watching The Source on CNN Philippines. Our guest today, former COVID-19 Task Force Advisor, Dr. Tony Leachon. Dr. Leachon, so let me ask you this. If the seven commandments were followed to the letter, and yun po ang i-implement, malaki ho ba talaga yung difference ng 1 meter sa 0.75? Is it that big a deal?
Malaki ang difference sa Pinky ayon sa pag-aaral. Pagka 1 meter, single lang, 82% reduction. 2 metro, 91%. 3 meters, 96%. In fact, the greater the distance, the greater is the reduction. So kung less than 1 meter, it should be below 82%. Ang face mask at saka face shield, singular, 67%, 78%. So pag kinumbine mo actually ang face mask and face shield, 93%. Pero pagka nag-distancing ka ng 3 meters, 96%. Pero pag kinumbine mo ang 1 meter, face mask at face shield, 99% reduction. So therefore, they should be used in complement
I
or
see.
complementary to each other. Ang mas maganda
Okay.
nga suggestion dyan is increase the volume of the transport, pati PUB, kasi better ang ventilation. Kasi part of this is the indoor or closed spaces. Ang ventilation sa MRT and LRT may not be as good ventilation as compared, let's say, sa outdoor.
Right.
So the win-win situation is that you maintain the MRT, LRT at
Yeah.
1 meter, which is actually protective for the public. And then minimum na 1 meter, which is actually based on the global standards. And all the agencies except the OTR is advocating that. And then increase the volume of transportation, all modes of transportation, following, of course, the minimum health standards. Of course, the physical distancing, the face mask, and the face shield. Malaking bagay
Opo.
talaga yung
Opo.
physical
But,
distancing. Napakalaking bagay siya. So hindi siya
opo.
dapat bawasan ng less than 1 meter para mag-adjust po tayo dito. I
What,
think it will be a disaster
as a la-
pag binawasan natin yan at hindi ho tayo makaka-flatten ng curve or magiging malala pa in the next few weeks. In fact, ang projection ay 688 cases per day pagka ginawa natin yan. And that will also lead to increased number of deaths in the long run. So yun ho nakakatakot based on the projections of the epidemiologists.
Actually, that's what I wanted to ask you. What was that number you said, the 688? My question really as a last question, Dr. Leachon, is that ano ho bang worst case scenario? Ano ho bang mangyayari sakaling i-reduce yung 1 meter to 0.75 and still following the seven commandments? What kind of surge are you seeing? Or what will studies show that what kind of surge could possibly happen?
Well, at this point in time, Pinky, ang situation natin 3,674 yung cases natin for the last one week Pagka binawasan mo to at status quo, then you will be expecting more. So based on the projections of Dr. Antonio Dans of the Philippine College of Physicians and UP, they're expecting a surge of
Yeah.
around 688 cases per day. And you can see the tremendous impact right now to our efforts. The gains generated from the last 6 months will be watered down by adjusting right now our physical distancing. Um, and that would be,
Okay.
a a big letdown for the Filipinos who have sacrificed for the last 6 months. I think we need to think into consideration that the all of these measures that we're doing are actually complementary. And if we will actually, uh, try to relax dun sa social distancing, malaking kawalan po yan dun ho sa ating efforts. So wag naman po. In fact, lahat ng efforts o ginagawa, even in the hospital setting, ang pinaka most effective actually are admin control and engineering. Ang protective face mask and face shield, sila ang pinaka less effective. Kaya nga hindi ka papasok sa hospital na
Okay.
walang proper distancing So in terms of the hierarchy of protection, you have physical administrative control over the protective gear. Yan ho yung hierarchy based on the studies. And even DTI and DOLE are advocating this.
Dr. Tony Leachon, all right, maraming salamat po sa inyong oras. Good to speak to you again. And coming up, a different group of medical experts is proposing the so-called 7 commandments to prevent commuters from contracting the coronavirus. We'll speak to Dr. Leo Olarte of Clean Air Philippines Movement after the break. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, Clean Air Philippines Movement President, Dr. Leo Olarte. Dr. Olarte, welcome to The Source and salamat din po sa inyong oras. So let me begin. Umpisahan ko na po. Kayo po, yung grupo naman ninyo, you're okay with this 0.75-meter distancing rule. Basta sundin naman yung 7 commandments.
Yes po. To clarify po, no, we are from the Clean Air Philippines Movement Incorporated. Our option that we endorsed to the IATF was that we are amenable to either 1 meter or 0.75 meters, as long as when they are in the train or in the public transportation, there should be no talking or no opening of the mouth. They should be strictly using properly a face mask, a face shield, and also that they should strictly have no drinking, eating, and speaking while inside the public transportation. Yun po ang aming option that we offered to the IATF.
Opo. So, could you explain to us, Dr. Olarte, to some health experts, they are actually saying naman, ang number one priority really is physical distancing. Even if you physical distance, and maglagay po kayo ng mask, maglagay din kayo ng shield, yung probability of infection, you will be, is reduced rather, kapag ganon. Pero kailangan i-maintain pa rin yung 1 meter. Bakit po kayo, sang-ayon kayo dun sa reduction to 0.75?
Okay po. In a study, no, we are basing our endorsements on a study. Ang aming nakita po is yung Duke University School of Medicine research na nagsasabi po na if a person uses properly a face mask, no, 99% po ang reduction ng COVID transmission. Yun po ang sinasabi sa Duke University Hospital Research po. So, ang pinaka-importante po talaga dito is yung paggamit ng wastong face mask. Now, bakit po yan? Because ang sinasabi po doon, wala pong klarong conclusive research findings that will say that a 1 meter distance within a closed space, no, like a public transportation, is effective. Kasi kung closed space po yan, the air just rotates around the closed space. So it has been found that even 1 meter or 2 meters or 3 meters, still there is an infection po as long as it is within a closed space. So useless po yung physical distancing of 1 meter, no? That is what we are stressing. What is important po, according to the findings, is the proper use of a face mask and no talking inside the public transportation po.
So basically, Doctor, what you're saying is that kapag nasa enclosed space, wala na pong, parang hindi na po importante ang distansya. Ang importante dito, whether it's 0.75, 1 meter, 2 meters, ang sinasabi nyo, ang pinaka-importante dito ay ang face mask.
Yes po, yan po ang totoo. In Japan, no, makikita po ninyo, in Japan, yung mga tao na sumasakay po sa train, side by side po sila, pero hindi po sila nagsasalita and they properly use the face mask. Also in Singapore, they are not particular with physical distancing. Ang importansya po sa kanila, ang importante po yung proper use of the face mask and face shield at saka hygiene. And hindi po nagsasalita sa loob ng sakyanan because this is a closed space po. That is also true in Taiwan, China, and in South Korea. Ang kanilang statistics po bumababa. Yun po ang aming base. And we have also to listen to the public transportation po. We have to revive our economy kasi marami din po ang namamatay pag gutom po sila. Criminality increases, no? Poverty also increases. Tuberculosis, which is also another public health hazard, also increases. Ang tuberculosis lang po, marami ding namamatay dyan, is probably equally dangerous also as COVID. But we are so much focused dito sa COVID. There are many diseases arising from poverty. So we have to revive po the economy. We have to get a good balance between health. We are for health as doctors, but we know that health also is being also favored if the economy is good.
Doctor, you know, I have to say this. Who are we supposed to believe? Because you're stating a medical report from the Duke University. Si Dr. Leachon was also stating a report from the Lancet, and that's the medical journal for health also. So would you say there are conflicting findings, or you are just interpreting it one way and the other is also interpreting it in another way?
That's why po sa aming grupo, sa Clean Air Philippines movement, we embrace both 1 meter and 0.75 meters. It can be imposed simultaneously po. If there are public transportations that prefer a 0.75 meters, that is only a very small difference to 1 meter. Then have them impose the 1.75 meters in order to increase passenger ride
capacity.
And if yung gusto po ng 1 meter, the 1 meter po kasi I have personally observed the people queuing, lining po dito sa MRT. Ang haba-haba po ng linya. And the more they are exposed there, they're waiting there for the ride, grabe din po ang infection diyan. Nagsasalita sila, ang social distancing diyan becomes less effective dahil tumatagal po sila doon sa queuing and naapektuhan po yung kanilang trabaho. So we also consider that po na kawawa naman yung pila, napakahaba po ng pila at saka marami po hindi nakakasakay.
Okay, so unfortunately, Dr. Olarte, we've run out of time, but I'd like to thank you so much for this interview. Thank you to Dr. Leo Olarte, President of Clean Air Philippines Movement. And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.